to this point, one of the biggest reasons why having all these community groups working together on it is to rely on each other's information, but also none of this would have been possible if we didn't have trust of community members. There's no reason, the reason why people weren't going to the clinics that the state was providing, the reason why people were uncomfortable with the vaccine, you know, even in general, is all based on trust. And who has the trust is all the community organizations. But like Wichie said, I don't have trust with people that Wichie has trust with, and vice versa, and that's across the board. So with that trust, then we're able to get people into the door, and once we get people into the door, we're able to do all the kind of case management that one would need, because I know what another Ethiopian might need, because I grew up with this person and they used to, you know, work with my mom on, you know, I have these relationships, and Thato has all these relationships with other people, and together we can get most of the people, if not all of the BIPOC people that are trying to get access to this thing. But the other thing I'll say is that we are able to learn off of each other. The only reason we were able to do the work that we were able to, I just want to emphasize that point. The form, the intake form to sign up to get your vaccine was because Wichie's group created one already. We used that one, we refined it for our context. The language access process that we had is because AALV had already set that up, and then we learned how to do that and then take it a step forward in whatever way that we could do it. And then by that time, we were sharing names. Oh, our clinic is full, we'll send them to your clinic. Your clinic is full, you're on Thursday, okay, we'll take you on Saturday. And before you know it, we have our daytime jobs, and at the end of the day,
but not actually doing our daytime job.
At that time, it's all mixed together. The most pressing issue in the world is how do we get the vaccines to people?
Like, someone from Brattleboro is coming up to Burlington, but let's get them at the Brattleboro clinic.
Exactly. We're calling Wichie to be like, do you have room in your Brattleboro clinic for someone who lives in Bennington? And so then there's these spreadsheets with all these people's names and like what their qualification is and whatever. And anyways, the mess that it is to get these things going. It is the 10 p.m. call to Weiwei. Like, is this person on your list? Or they're coming in tomorrow morning and they need an interpreter. Do we have an interpreter for that? It was just a mess. But I will say the reason why we were able to put those pieces together is because we worked together. And that wouldn't have happened otherwise. And the state itself, although trying, wasn't doing almost any of those things as well as it needed to be done. And we were able to kind of get together and do them for the state.
Absolutely, it was such a great help with them having organized the spreadsheets and having a form for everybody to fill out, because having all those names, I mean, it was thousands of names on that list, and having to call everybody and knowing exactly what they needed before I was able to call them, make sure I can get everything set up. You know, it was a huge help. So having partnership is exactly what it is. And like they said, having a trusted community member. A lot of people knew me from working at the hospital. I've worked all over the hospital already in different hats. So a lot of people already knew who I was. They trusted me. Me being a BIPOC person myself, I already know that it's very imperative that we're working. You know, we don't get the privilege to not work all the time. We have to work. We live in basically paycheck to paycheck. And so usually having the weekends was easy for me, but it was really hard for the state to accommodate that. But we had to make them do that because this is what we needed to access, you know. So it was great being able to partner with everybody and working with everybody to do that, and that's what created a successful the success of the clinics.
And I must add, Weiwei, that partnering with key people who will eventually provide the vaccines, healthcare providers, was essential, because we know how to bring people together. We are community organizers. We provide case management, right? So we needed professionals who know the temperature of the vaccine and you know, we needed people with the money in the room, right? So it was very crucial that not only do we partner as an organization, we partner with our cities, we partner with the state government to do this work together. And I have to say that one of the things that emerged out of this, one of the beautiful things, was the recognition finally that it's important that we acknowledge that there's beyond English and Spanish. We also have 28 other languages in Vermont. How do we then provide services to those languages in real time, right? So a project came out of that, and one of our colleagues who's here today got together with somebody, we all came together and started what's now called the Vermont Language Access Project. Incredible work that without that collaboration, without that, coming together, we wouldn't have done it as effectively as we did.
I just want to say two things. One, off of what Thato was saying, is just like, not only did we trust each other, but the government trusted us.
Yes.
Right? Wasn't like, okay, we've designed a plan, here, implement it, and you're like, this is not realistic, right? Which is like what happens all the time. And I just want to note that the success of this was because the government stepped aside and trusted the people in the community and the community leaders and community organizers and people doing this field work day to day to design the plan that needed to be done to do this efficiently and effectively. And that needs to happen more. Okay. And the second thing that I want to note is that notice that one of the areas that definitely is not represented among these BIPOC vaccine clinics is the Northeast Kingdom. I had people travel from the Northeast Kingdom down to Brattleboro because that was the only BIPOC vaccine clinic at the time. And we need more resources. We need to be able to expand the type of work we do to empower leadership and build leadership in the Northeast Kingdom. And if it's already happening, then they probably need more resources. Because people need that, and I've seen that people need that.
Can I just say one thing about that?
Please.
I think it's so important to think about that because there was a call that I was on with some partners in the government, and someone was like, well, in our area, which was like in the north central Vermont area, we only have 10% BIPOC, so why do we need to have a BIPOC clinic? Which is, it's so harmful to think in that way because actually it is needed. It's actually critically needed for people to feel safe, to feel like they can access these clinics so that they don't have to go to Brattleboro, they don't have to come to Burlington, they don't have to go to Rutland, So thank you for bringing that up. What were you gonna say?
To Wichie's first point, there is a something we learned in this crisis mode. If our panel here is to talk about what have we learned about the future of healthcare and what it could be, we learned, or we saw in crisis mode how quickly things can be mobilized and how red tape can actually go away. That's the thing that I want to carry with us throughout. I work in government, so I understand it. I'm part of the process, I'm part of the red tape, and I want to be fair about that. But the red tape can go away when there's an emergency and a problem to solve. And that's what we were trying to do because everyone was focused on this one major emergency that everyone felt was relevant to solve. There are emergencies every day that we find to be emergent and that maybe the government isn't ready to acknowledge as an emergency, which is why cities and towns all over the place are recognizing racism as a public health emergency as a first step. But I guess this quick deployment of resources, this shift in how we work and how power and the people who sit at the table and are at the head of the table was way different when we were running these clinics. To Wichie's point, it was the first time in my time that we were doing this work in community groups where they were looking to us for information. We would say what we needed, and actually a lot of those needs would be fulfilled. And I had never seen that before. And as time goes on, some of that synergy diminishes, obviously, but I just want to recognize that model of just listening to the people who know what they're doing, giving them the resources that they need, whether it's money or staff, vaccinators, the National Guard came in for us, all of these things, it comes together, the promoting them to levels of, the City of Burlington or different news places, they held press conferences with us, we're able to get the word out about this. That's how we got it done. And that's how we were so successful in part, so.
We know our community, trust us to know our community, right? And we're gonna make you look good doing it, sorry. So then thinking about the future of, because we're already, what are some noticeable differences in your work before, during, and after this experience? I mean, it says after the pandemic, but I mean, to me, we're just looking at it, so.
I think, so I'm a processor, I have to say. I think prior to pandemic, there was an acknowledgement that there's a refugee community in Vermont. There's a healthcare system. There was never really lots of discussion about the integration of the two. How do we adequately provide culturally appropriate services to the refugee community, to the immigrant community, that enhances the city, that enhances the state. If you look at most jobs where production needs to happen, you see us, right? So that's very crucial to the economic improvement of the city, of the state.